Your voice, your opinion, your community. Fact TV, free speech, protected.
Local news, politics, business, sports, arts, music. Mike and Marty on the team. Mike and Marty. Mike and Marty.
Good morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty. Today we're here with Haley Druschel.
Druschel, yes,
Druschel.
thank you.
Thank you. From Springfield Hospital, we're going to be talking about diagnostic imaging. But first, Marty with local events.
Local events, Bellows Falls Opera House, not a clue.
Well, we know that it's not Thunderbolts.
It's not
anymore.
Thunderbolts anymore, but I'm assuming there will be a movie. I just don't
Yes.
know what. So it's kind of like a mystery. Take a chance. But I do know the classic movie. The classic movie this week is Funny Girl, The Life of Fanny Bryce.
Yes.
And truly a classic, back from Barbara Streisand's day of doing a lot of movies. And that is sponsored by Greater Falls Insurance. Happening on Saturday, June 7th at the Bellows Falls Opera House is 8084. Any of you that were around in the 80s, like myself, you might remember 8084 was a pretty local band that did pretty well, sort of making it big in the music industry.
I mean, it was regional almost.
It's regional, yeah. They really have some chops, and they were kind of back in the state of Vermont, and they're doing concerts around. And their opener is John Sullivan, who anybody from the Springfield area will recognize that name. And just a sneak preview, we are hoping that we can coordinate to actually have the members of 8084 remotely on the show next week.
Oh, great.
So
Wonderful.
to tell you like kind of what they've been up to, what to expect at their their concert, because they're coming to the Opera House, and the Opera House is a great place to see live music.
Certainly is.
So, just one more thing. Shout out to everybody that won their seats in the village elections. I believe Paul Bohosky got the village president. Samantha Snow got a seat on the trustees, and Susan McNeil was appointed, but she's won her seat. And all of the budget passed, and all of the amendment articles at the village meeting passed. So,
Good. Haley, how are you?
I'm doing well. Thank you so much for having me.
So tell us a little bit about yourself and
Sure.
Imaging at Springfield Hospital.
Okay. So again, my name's Haley Druschel, and again, thank you so much for
You're
having me. I
welcome.
really do appreciate the platform. I had done my Bachelor's of Science degree in nuclear medicine at the University of Vermont. I did my clinicals at UVMMC, or back when it was Fletcher Allen.
that was a while back.
Dating myself a little
Yeah.
bit. Pushing about 20 years in the healthcare field
Really?
right now.
Yeah.
I did my internship at Dartmouth. I've only worked at local facilities since then. I furthered my education at the Southern Vermont College for my CT post-primary certification, and then I obtained my Master's of Science degree in Healthcare Administration at Champlain College.
Yes.
So definitely
It's a
keeping
lot
it
of I
local.
was gonna say there's a lot of initials after Haley's name.
So much so that we couldn't put them
We
all
couldn't fit them
the-
on the screen. So you do win the dubious honor of that's the first time that's ever happened.
At least that's okay. That's okay.
Bragging rights.
But you're the director of diagnostic imaging, is that right?
Correct. Director of Diagnostic Imaging. So it's often called radiology, but we like to include ultrasound and MRI. They both are not, they don't include radiation. So
that's
it's
true,
kind of
yeah.
the title has transitioned to diagnostic imaging just to be inclusive to all of our modalities.
Mm-hmm.
But at Springfield Hospital, we do have many modalities. I joke that we are small but mighty.
Yes.
We offer X-ray, fluoroscopy, CT, ultrasound, echo, mammography, bone density, MRI, and nuclear medicine. So we offer a lot of services for such a small local community hospital.
Can you go through, we have some images, and hopefully we can get the images connected to what you're talking about.
Sure, absolutely.
But can you, as we pop up an image, can you kind of tell us a little bit like what that would be used
Sure.
for, what it's pertinent for, and we'll, without taking, there we go. So we have the MRI.
So this is actually our new nuclear medicine unit. So I'll kind of preface this by saying in the past, I've been at Springfield Hospital for just over 3 years now. And during the past 2 years, we've been really reinvesting in our equipment substantially. It's something that I'm quite proud of. Of those units, nuclear medicine is one of the newest that we have. We've had this open for just over a year now. We actually did not have nuclear medicine services for a couple years, so I'm ecstatic to be able to bring this back. Nuclear medicine is a variety of, it's more of a specialty imaging. Our most common, I would say, is cardiac imaging. Essentially what we do is if someone's having shortness of breath or maybe chest pain and abnormal EKGs, things of that nature, this allows us to do imaging, or we're switching gears here.
Yeah.
But
Sorry.
but going back, is that what, like, there's like the MRI machine that sort of looks like that, but that's not it.
Like it. Correct. They're all very big, kind of donut-shaped looking machines.
That you ride through.
Right.
Yeah.
With this,
Is it like a PET scan then? Or?
so a PET scan is under the umbrella of nuclear medicine,
Okay.
but this is not a PET scanner. This is a brand new Siemens Symbia Pro Specta. This is actually the first one of these particular units in Vermont and the fifth
Really?
in New England.
Yeah,
So
yeah.
again, very proud of that. The difference with nuclear medicine is instead of the radiation coming from the machine, we're actually administering a
So you get an
radiopharmaceutical
infusion?
to the patient.
Yeah.
So either we can do it by injection, or we can give, if we're looking at the stomach, we can make radioactive eggs and have you eat it. If we're looking at your thyroid, we can give you radioactive capsules. If we're looking at your lungs, you can, kind of inhale radioactive material. But the key piece is that we're giving you or administering that radiopharmaceutical, and then we actually image where it goes in your body. So nuclear medicine is a little bit different of a beast because we're looking at more physiology rather than just anatomy. But I'd say the most common exam that we have is that cardiac imaging I mentioned, or myocardial perfusion imaging, and what that does is we're able to image the blood flow to your heart muscle, so through those
that's
coronary
interesting.
arteries, and see if there's any narrowing or blockages in those coronary arteries. And it's the least invasive
Right.
procedure besides going and getting a catheterization. So, and the images are extremely sensitive. So that's something that we're very proud to offer now. And I know he was switching over to Echo, but that's another one of our new units. We have a new Echo machine. This is more of a ultrasound of your heart. Other new pieces of equipment, I'm not sure what we have next. But I will say we've been renovating this space.
There
This
we
is
go.
one of
This
our
is-
new X-ray rooms. This is a fluoroscopy room. This is a brand new Philips unit, the Philips Proxy Diagnostic. We also have the Philips Digital Diagnostic. That's our other brand new X-ray, which I believe you have a picture of as well that says DR room.
Oh, okay. So you use
that-
fluoroscopy is
Fluoroscopy is kind of like a movie X-ray.
so
where
it's
you're
like-
able,
yeah,
right. So
okay.
a lot of joint injections
Yeah.
or modified barium swallows we do in this room. But we were able to renovate and refresh our X-ray spaces. We have those two rooms, as well as our portable unit. I'm not sure if we have a picture. I don't think we actually have a picture of the new portable unit, but it's also a Philips unit. That was one of our annual giving campaigns
nice.
2 years ago. So we feel very thankful for that. Another X-ray unit is the C-arm we got that is new. It's a GE C-arm. That's it. And that's for use in the OR. So if you need an X-ray during surgery, that allows
that
us
you
to
can
do
just
that.
bring it in there.
Exactly.
Oh, that's
Yep.
pretty amazing.
That's pretty state of the art.
It is.
Yeah.
It really
Yeah.
is. And we went with GE. I like to point out that we're not, some facilities are very specific and they only do one particular vendor. I'll say when we were researching this, we went through demos. We had all the vendors come in. We included our staff that's utilizing the equipment as well as the radiologists. radiologists who are reading the exams, they all took note and had a voice in kind of determining what piece of equipment was best for us to get at the time. So you'll notice, like I said, nuclear medicine was Siemens, a lot of X-ray was Philips, but that C-arm is GE. So we're not kind of set in stone for one.
And might you be the machines that you have, might those be equivalent machines to, say, larger hospitals?
Absolutely, absolutely. So, and I'll kind of lead into this as well, that we work closely with Dartmouth, our largest tertiary center nearby. The radiologists at Dartmouth actually protocol all of our exams, and they dictate them or read the exams at completion.
Yeah.
So, and we actually have a Dartmouth radiologist that comes once or twice a week to help that they complete procedures. So we are
So you do that
closely
over
tied.
the internet, obviously.
So
am I
the
right?
correct.
Yeah.
So the reading of the exams, Dartmouth has access to our images.
Yeah.
So they're able to see everything at different appointments or whatnot. They're able to see all of our images.
So if I'm understanding you, what I'm understanding you saying is that if I needed an MRI or if I needed one of those tests, I could go 15 minutes north.
Absolutely.
I could go into like a smaller place that I'm not going to get lost in.
Right.
I'm probably going to run into somebody that I know there,
Right.
and I can get an equivalent, basically the same
100%.
thing,
the same
equivalent, but I can get it quicker and local.
Absolutely. The whole goal for us is easy access, high quality imaging, and that personable care.
So when you're talking like wait times, if I were to call you and wanted an appointment,
Sure.
what is it, like 6 months, or am I going to
So
wait?
it's funny that we talk about wait times because we did just complete our audit for the state of Vermont. So I brought so I didn't misspeak, but for our high-end imaging, MRI, CT, nuclear medicine, our numbers for February and March for those particular modalities. In February, 97% of our MRI exams and 91% of our MRI exams in March had our patients come in the turnaround time within 14 days.
Wow.
And that's not 14
fast.
business days,
No.
it's 2 weeks, and it's extremely quick turnaround.
That is, because a lot of your diagnostics are diagnosing. That's not even a word. Diagnosing things like potential cancer.
Exactly.
So that's 14 days of waiting and wondering versus perhaps months.
3 months of
Sometimes
waiting and
I'm
wondering.
hearing from other folks that maybe go other places, and one of the big ones that I think your MRI is, talk about the prostate.
Absolutely.
Prostate imaging.
So the prostate imaging is this is the last actually piece of equipment that is new that we've gotten within the 2-year span. Our MRI unit, with the upgrade that we have, we're now able to complete prostate imaging. And what's great about that is that we're working closely with urology. On our end, patients would typically have to go to a larger institution to get this done, and the exams would take upwards of a 2, 3, 4 month wait. We can get folks in within 7 to 10 business days. On top of that, working closely with urology, from what I understand, from the patient having their MRI done, to having their appointment in the office to review that MRI and then get them squared away for their prostate biopsy, which we can now do at Springfield Hospital as well. That time went from that whole process taking 3 to 6 months to now 2 to 3 weeks, which is
That's amazing.
it is fantastic for our patients.
It is when you're wondering.
Right.
When you want that plan, you want to know what your steps forward
Right.
are. You want to know, and all that time that you're waiting, it just creates more and more angst.
And we recognize that we play a major role in diagnosing and the treatment of patients in their care. And I'll go back to the wait times for CT. In February, 94% of our patients were seen within 2 weeks, and in March, 81%. And in nuclear medicine, it was 100%. All of our patients were able to be seen within 2 weeks. And when I say be seen, that's from when we received the order from the office, reached out to the patient to get them scheduled, got their appointment, and then had the exam.
Wow.
So the entire process.
Yes.
Oh, that's
That's-
even quicker.
It is.
Yeah.
It's the whole thing.
Yeah.
And what can happen is, some patients are on vacation in the summer. Maybe they
Oh,
don't
yeah,
want
yeah.
it for a week or two. Some exams, they shouldn't have it done for, maybe it needs to be a month out. So that can skew numbers as well. But this is something that we track, and we really take, high priority to make sure that we're getting folks in and easily.
Yes.
So I guess that just begs the question, like, why wouldn't you go to Springfield?
Right, and that's the thing, is that I think that's the biggest goal for me here coming today, is just to empower patients, to let them know that they can have these
Yes.
services here at Springfield Hospital locally. I've been on the flip side of that as well. I have a personal example where I have an immediate family member that has gone through many surgeries, many spinal surgeries, unfortunately, in the past few years, and working with their neurosurgeon, who was fantastic, but my family member required a nuclear medicine study, and the neurosurgeon was very adamant that this needed to be done at the larger institution. And I know myself, as a director of diagnostic imaging, having that background, nuclear medicine tech by trade, I had to very firmly assure them that yes, we can have this done at Springfield Hospital. It's going to be easily accessible to you. You're not going to have any trouble viewing the images. It's going to be done the way that you're used to. Again, we do follow Dartmouth protocols. I think that's very telling. I can only imagine how challenging it is for patients when they're trying to navigate their care. And we just want to really try to ease that burden to make sure that we're available for patients. We make it easy to get in. You have the highest quality images. And just very personable care. As you said, this is, our patients are our neighbors, our family, our friends. The folks that are staffed in our department and the facility are professional and knowledgeable. Everyone has been through, the local area, and they have a lot to give, I think, is the other thing, is that they really have a stake in the facility. In our department specifically, there's a level of caring, that
There's
that's
skin in the
different.
game,
There
right?
is.
Because a
Yeah.
lot of times you are seeing the person that you see at the coffee shop every morning, or
Right.
your neighbor down the street. And I think so. One of the things we talk about a lot here, we do it specific to like retail businesses. We talk about shop local.
Right.
And there's been a big push in Bells Falls in general. I think Springfield does the same thing about really getting people to go to the small mom and pop shops, go to the coffee shop, go to here. Not so much the chains. Chains when you need to, because that's what they're there for. So it seems like that applies to healthcare too, and it seems like that's what we used to have.
Right.
You used to have your doctor that lived down the street. You went to his office in the back of the house. He knew you. You knew everybody. And it just made it more pleasant. You weren't a number.
Oh, I agree.
I'm not saying that's always the case in a bigger location, but sometimes you're a number.
Right.
And in a smaller location, and also you going to a smaller entity, you going to your local hospital, spending your insurance dollars or your self-pay dollars at a local hospital, that money stays local. It
does.
provides local salaries. It provides. It seems
And it
like that's
provides
what- it seems
local
like-
access, so that when
Well, that's the
something
thing, too.
happens
So
to when
that-
you
yeah,
actually
because
need
if-
immediate care,
Right.
it's there.
Oh,
We really
nail
see
on
the
the head
value
point.
of having
Yeah.
the local facility
Yeah,
in the community.
exactly.
Absolutely.
Yeah, because big difference when something's going bad. You got to drive 20 minutes or you got to drive 45 minutes.
right.
Personal
Yeah.
experience.
Yeah, yeah.
That's
I
the
don't,
thing.
don't want to go into too many.
And when you're in school in healthcare, it's often, it's the cliche example, pretend it's your mom, pretend it's your grandma, but it's easy to do that when you're in a smaller facility, because sometimes it is, it is someone that and I think all of the staff that are at the smaller facilities, they understand that, and that's what they're looking for, and that's why they're there.
Oh, see, that's why they're working there.
Exactly.
Because they
Yeah,
want
exactly.
to. That's where they want to work.
That's
They
the
want to be
draw
part of
to work in a
community.
smaller facility, is to have that personal
And there's
touch.
there's a certain capacity level too. I'm assuming that at some point, like larger hospitals, and even some of the talk in the state about consolidating hospitals, at some point, there's going to be a capacity tip where you just can't take any more patients at this larger
Right,
hospital because
exactly.
there's not the capacity.
Right.
And it almost seems like why would you not have little, like, more local
Right.
places and places that you can go. One of the things you mentioned when we were talking before the show is you were talking about you work with River Valley Tech Center. You
Right.
actually have students.
We
that
do
come
have
in.
students that come through. We have X-ray students that come through the department, and I've hired a couple of them. They're fantastic,
Neat.
and again, they're looking to stay in their local community, and it's close to home. Who doesn't want a 10-minute drive versus an hour drive potentially? But it's great. I definitely love that we're able to kind of bring the next generation of technologists operate in our facility.
And you can, I mean, basically, this seems to be a little less the norm now, but you can work your whole career local. Like,
Oh,
you don't have to
absolutely.
shift around. You've got state-of-the-art equipment. It's not like you're
Absolutely.
working, you've got all the perks. It's local, it's state-of-the-art.
And that brings that wisdom too. We have staff in our department that, as I said, new grads, that we bring aboard, and they bring fresh eyes and, a different level of excitement to the department. And then we have staff that have been there for decades. We have certain technologists that have been there for over 20, 30 years. And patients that come in, they ask for them by name. And as I said, I've been at Springfield for just over 3 years now, and the feedback that we've been getting is extremely positive. I think it makes me very proud to work with the staff that I do, and I think we're just kind of building that trust with patients every interaction that we have with them.
And it seems like you're really dynamic now, because you went through the difficulty
Right.
5 years ago of having to reorganize and
Restructure
restructure, and now I see that a lot of the changes that are happening in the state are forcing others to
Right.
reorganize.
We're a little
and restructure.
ahead of the game
And it
in
seems,
that way.
you're dynamic. You're like, okay, we're doing it already.
It's true.
Let's keep doing it.
And I think that's actually, there's always a little bit of, silver lining, a little bit. And I dare I say,
There you say,
but,
Heck of a way to get a silver lining.
I know it certainly is. But with that being said, we have, come out with those fresh eyes, as I said too,
Yeah.
where our focus, it's not just status quo, which often is the healthcare field, where you might have an upgrade here or there, or a project here or there, but it's very, keep things par.
Right.
And there's no status quo. I can speak for my department as well as the facility.
Just when you were
Everything
talking
we
about
touch, we're
vendors,
looking to get
that
better.
you use the best vendors instead
Absolutely.
of just a vendor that we've always used.
Right.
Yeah.
And we're not doing things the way that have always been done. We're looking to see, can this be done better? Or if it's not broken, don't fix it. But everything's being looked at very carefully. And I think that's what's exciting. It's exciting to be a part of a facility that's really looking forward and knows that you can fail, and actually has.
You went through the worst, you
Right.
survived, and you figured out what it almost silver lining. It almost helped
Exactly.
you hone in on what do we need to do.
What do we need to do? Where do we need to put our focus? Obviously, for my department, we're reinvesting in the technology. But yeah, absolutely. And in as I said, the staff that are here with us are along for that ride. That's the journey they want to be a part of, is something that's meaningful. And you actually see the progress. That's what's awesome too, is that you're actually seeing the progress you're making, and it allows for the opportunity to do that. But everything that we touch, we look at thoroughly and see what can we do to make this better. Nothing just, we don't turn a blind eye to anything,
Yeah, because like I said, you were kind of forced to, but
Right.
in the fact that you were forced to, it actually became. I think you used the term superpower.
Yeah, you're right.
Superpower of Springfield Hospital.
I think it is.
They really been through the worst and coming out of it, and really looking to just be a better local resource.
Absolutely. That's exactly it.
And that's a big plus. Did we miss any of the machines?
I think, did we show the MRI? Let's see here. I'm not sure.
We don't know.
Oh,
There we are.
So there's our MRI unit. Again, it's a beautiful suite. Even in the nuclear medicine space, we have the lighting.
Yeah, it looks wonderful.
It's calming for patients. It's comfortable for patients. In MRI, we have music, headphones and whatnot to make it a little bit easier. But I definitely love our facility, everything again that we're we're doing, we're revamping as we go along, and we're not done yet. So I guess that's something that I should probably share is that, we're on the cusp this summer of getting new ultrasound equipment. As far as preventative care goes, we do CT lung cancer screening, and we're starting the process of being ACR accredited. That's the American College of Radiology. It's kind of the gold standard just to give that stamp of approval. They go through your equipment and your pictures of the images that you submit. So we're doing that, as well as nuclear medicine I talked extensively about, but we're also adding an additional exam in nuclear medicine. It's called DAT scan, and that's for Parkinson's imaging. So that's going to open the door up some more. So there's, as much as we've done and how proud I am of where we've come in the past 2-3 years, there's still, we're still looking ahead, and we're still looking at more services to offer and improvements to be made.
Wow.
So we have like 30 minutes, and I'm just 30
30
minutes.
minutes? Wow.
We had a long time. Sorry, that was only the appetizer. We have 30 seconds, and I just want to say, because I'll say this so
Yes.
that you don't get in trouble. So if you're in need of these imaging things, and you go to your doctor, and your doctor says, you got to go to a bigger hospital, you might just want to say, I have a choice, and you might want to explore.
Absolutely.
Another
Be
option.
proactive in your care.
Yeah. Yeah,
Absolutely. Have that confidence to be proactive in your care. You play a major role in your care. It's a team effort. And absolutely, be empowered and know what's available to you locally.
Oops.
And
And
that's a wrap.
that's a wrap.
Thank you so much.
Thank you.
It's been an experience.
Thanks for coming.
Bye.
And that's it for this week. We'll see you next week on the feed. Huh?